Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning in to my latest video. The patient in this procedure attended with a fully blocked left ear. They had been using hydrogen peroxide drops, and quite often with hydrogen peroxide based drops, patients report a fizziness in their ear. They can feel their ear popping and crackling, and that's because the hydrogen peroxide drops itself, it can create a fizzing sensation. When it reacts with the wax, you get some fizziness there, and you can actually see these little air bubbles within the drops. You can see that fizzy appearance it's giving in the ear. Now, the patient is a police officer and they wear an earpiece, and what they believe has happened is over the last few years they generally wear the earpiece in the left ear, and it's pushed this wax really deep in the ear, and it's actually cemented itself within the ear canal. The wax, apart from this surface layer that has slightly softened due to the use of the hydrogen peroxide drops, the main body, the core of this plug of wax, it's rock solid, and it's cemented itself very deep in the ear. So I've just tried to use an ear hook, trying to prise the hook into the core of the wax and extract forwards, but it hasn't. It's just dissected this outer surface layer, and so wasn't very effective at all in removing this plug of wax. Patient has been experiencing a lot of earache as well, so we have to just be extra gentle and cautious whilst we're in the ear. I think they took a couple of paracetamols prior to attending, due to the severity of the pain they're experiencing. And we call pain in the ear, localised pain in the ear, we call that otalgia. So I've just resorted back to the Zollner suction probe. There's nothing else I can use. I can't use forceps because there's nothing to grip onto. I've used an ear hook, a Jobson Hornby, very similar outcomes as the ear hook. And you can see these little circular little wriggles I'm making with the suction probe. I'm just trying to loosen the wax off the canal wall and actually trying to roll this forwards. And I think I'm going to give it, you can see just the canal wall has become a bit more visible there. It's really red, and that's because this plug of wax is, as I said, it's tightly adhered to the canal, and as this plug of wax is expanding, it's compressing against the canal walls, hence why it's extremely red. And we are on the bony part of the ear canal, so this wax is impacted quite immediately. And I'm just going to the posterior canal wall, the back part of the ear canal, trying to loosen the plug of wax from there. Just going back to the roof of the ear canal, trying to roll this downwards and forwards, but it's playing hardball with me at the moment. There's a few hairs there as well. You can see there's a few matted hairs, and so some advice I've provided to the police officer is to see if they can alternate wearing the earpiece between ears, so you're less likely to impact one ear. They do assure me they don't put anything else in their ears. I've advised the police officer also, when trimming their hairs, their ear hairs, to position a bit of cotton wool with some Vaseline just at the entrance of the ear, just to block any loose hairs from entering the ear. You can see I've just managed to loosen this plug of cemented wax off the posterior canal wall. I'm slowly now just trying to bring this forwards. And you can just see as I'm lifting this plug of wax off the canal wall, just how red the canal wall is, just how bruised it is. That will all settle down now. And at the base of this plug of wax, you can see a thin film of dead skin, the keratin. You can see it's a glossy, yellowy, textured material at the base of this plug of wax. I'm still having a fair job trying to bring this forward, so the plug of wax is actually a bit larger than the entrance of the ear canal. You can see it just tearing away there, a segment of it. So this is still the main body, but I've brought it right near the entrance, and we know we're at the entrance of the ear because you can see all the hair strands, the cilia, so they're only located near the entrance in the outer third of the ear canal. And these little circular movements, rocking the wax backwards and forwards, that will loosen it from any skin adhesions that are attached to the ear canal wall. So I've just rolled it forwards there. Otherwise, the patient's eardrum's nice and healthy, it's intact, but the inner third of the ear canal is extremely red, it's bruised, it's fine though. The patient was over the moon, you can hear all of a sudden. So there you can see a still image of the plug of wax. I did measure that little plug of wax, so it's about 1/4 gram. I hope you enjoyed that video, guys. Sorry, it's a short, quick one. It's been really busy over the weekend. I had a earwax course yesterday, but I just wanted to upload a quick video for you all today. Hope you enjoy your Sunday, and I'll speak to you all soon. Bye.